Hi, I'm Johnny.
Hi, Johnny.
Nice to meet you. And you're Ivy.
Uh-huh.
Okay, Ivy, I'd like to thank you for coming in today to Pathways. I guess I'll first start out by just giving you a little information about our program. Pathways is a transitional living program that assists those who suffer from either a mental health issue or a substance abuse disorder. It's a program that lasts anywhere from 90 days to a year, depending on the client's desire to address their issues and their willingness and the type of foundation that they build for themselves in their recovery. This process that we're going to do today is basically a screening process that will help uh, myself as well as our staff determine your eligibility for our program. And once we go through some information here, I'll consult with some other staff members and we'll determine at that time whether or not you would be a good fit for our program. So if you don't mind, we'll go ahead and get started with these questions.
Okay.
Some of them, go ahead, I'm sorry.
I was going to kind of tell you what brought me here.
Okay, so what brought you here?
Well, I heard about Pathway.
Uh-huh.
Um, and I've probably been drinking for how many years? I started when I was 16.
Started when you were 16.
Mm-hmm.
Okay.
And, you know, I drink here and there, drink on the weekend.
Sure.
Um, I think the first time I got in trouble when I was about 20, I got arrested for drunk driving.
Okay.
And went to court and had to pay a fine. There wasn't any probation or anything. It was my first time.
Okay.
And then I had to get special insurance to drive.
Mm-hmm.
And just gradually, it just kept progressing more and more till by the time I got to be dependent on it, I was already dependent on it.
Sure.
And then again, gradually, by that time, it's kind of like anybody in my life, which I'm with my sister, not
Okay.
working.
Okay. You live with your sister?
Mm-hmm.
Okay.
Not working. My attitude was, I'm going to drink, and if you can deal with it, okay, and if you can't, don't come around me.
Okay.
So pretty much my parents are deceased. My father died from tetanus, lockjaw,
Okay.
from stepping on a nail.
How old were you when that happened?
Probably about 18.
18. Okay.
Yeah, and it was kind of unheard of, but my mom was a Christian Zionist, and they don't believe in shots.
Okay.
And so as far as family and growing up or whatever, pretty much everybody realized I was having a problem and had maybe mentioned it, but I would ignore it or not want to do anything about it.
Okay.
So it's pretty much every day now.
Okay. Every day now.
Yeah.
You drink every day?
Mhm.
Okay. And would you say that you're experiencing, problems with regards to your drinking?
Well,
Blackouts?
Absolutely.
Yeah.
But I've had blackouts for a while.
Okay. How long have you
Several
been
years,
having?
probably.
A couple years?
Mm-hmm.
Okay.
As far as problems, I'm not working. I lost my apartment. So I do definitely in every area of my life have problems.
Okay.
Because
And
all I want to do is drink.
Sure. And so how did you lose your apartment?
I lost my job and didn't have the money to pay rent.
Okay. Okay, I'm gonna ask you a few questions here. You said your primary drug of choice is alcohol, right?
Mm-hmm.
Okay. And any other substances?
No.
No other substances. Okay. Have you ever been to a detox program or inpatient treatment facility? Never have. Okay. So if you don't drink, what happens? Do you
It's been
experience?
so long since I didn't drink that I don't know.
Okay.
I mean, I don't not drink.
Okay. Okay. How about legal history? Do you have any current legal?
Not current. I got arrested when I was about 20 for drunk driving.
Right. Okay. With no current legal history. Okay. So, what I would suggest, just in speaking with you, I would probably suggest that we would refer you to a detox program. I'm a little concerned with the level of alcoholism that you're demonstrating. I think that it can be a very dangerous thing, and when somebody drinks to those levels, and I think it would be good if you were to go through a detox program. You seem to be a good fit for us. I just have concerns with that. If you're able to get through the detox program successfully, we bring you here to Pathways and get you started in our 90-day residential program here at Pathways One. Here at Pathways One, we have a lot of meetings and things, Alcoholics Anonymous, as well as some other 12-step functions. And I think experiencing that will help you with beginning to understand more yourself about your alcoholism and how you can now start to do things within your life to help you with not drinking anymore. And then it would be determined on you whether or not you would want to progress on to other pathways.
Right. When people first come here, do you guys have some sort of grant that will help with rent until I'm able to get a job?
We do have certain grants that are available for certain populations. It would just be a matter of getting some more information from you to determine your eligibility. However, just because you don't have the adequate means to pay for Pathways does not necessarily mean that you would not be accepted.
Okay.
There would be some more screening that would be done by our facility to determine your benefits that you'd be available for.
Okay. And do you guys do people have visitors here?
You can have visitors here. They need to be ran through the staff who's going to be visiting, and they'll make a determination whether they're able to come visit you or not. And we do have visiting. We got certain hours that they're able to visit. They would have to come here to the facility, and they would have to sign in. And then, of course, when visiting's done, they would have to leave.
Okay. So you said that you'll be able to talk to the people on this detox?
Pardon me, I'm sorry.
You said that you'll be able to talk to these people at detox
Yes.
and to find out if they'll let me come there?
Yeah, I will call them when we're done here, and I'll be able to determine your eligibility for going over to detox. It shouldn't be a problem. We should be able to get you in.
So if you talk to them and I can go there, then how will we do that? I mean, how do I get there, or what do I do?
Well, we can get that set up. We can have somebody from here take you over there if you're willing to go today, which is awesome, and get you started.
Okay. Well, I really appreciate you suggesting detox, because it worried me kind of thinking about having to stop drinking.
Sure. Yeah, I can understand. It's certainly very scary to be in that type of situation. I appreciate your willingness for coming here today and being willing to start to take a look at some of your problems.
Okay. Well, excuse me. I'll go to the restroom, and if you want to see if you can get a hold of somebody.
Okay.
And I really, really appreciate you talking to me.
Thanks for coming in.
Okay.
I'm glad that you came in. You made this decision.
Okay.